Well, earlier this week here at KCTV5, we opened a phone bank for healthcare in the Heartland. That's a time when we bring in independent agents to help you make health insurance decisions for the year ahead. KCTV5's Carolyn Long tells us what you can do if you miss the chance to ask those questions. That's today's Aging in Style.
Open enrollment is quickly approaching for Medicare recipients, a window from October 15th through December 7th when you make new choices or pick a plan that might work better for you.
It can be very complicated.
Gail Meadows is the director of Medicare sales for Aetna. Her best advice is not to try to decipher the mounds of paperwork on your own. Take the time to seek the advice of an independent agent.
They can look at your needs, look at your medications, they can look at your physicians, and what type of medical conditions do you have, and all of that's important to make sure that you make the right decision at the right time.
Just as plans can change, so too can your health care needs since you last made your selection a year ago.
Having someone as an agent with you can help you every year when these plans introduce the changes for their following year. So medical benefits change, networks can change, it gets very complicated.
You might be put on a new medication, you might have been diagnosed with something that is going to change not just your health but your financial health because of the cost of what it costs to take care of it. And all of those things need to be taken into account when making these decisions.
Faraz Katan is an independent agent. He agrees that now is the time to ask yourself some important questions. Are you satisfied with your current coverage? Are your out-of-pocket expenses too high? Has your health changed? Do you anticipate needing added medical care or pricier prescription drugs?
It would really help to talk to somebody who knows what's going on.
And now is the time to do that.
Particularly for Medicare people, correct, because they only have a set amount of time to make any changes to any aspect of their Medicare, particularly their drug plan, or if they're on an Advantage plan.
Now, if you are satisfied with your current Medicare plan and it is still being offered, you don't have to do a thing. The coverage you have will continue. Carolyn Long, KCTV5 News.